Okay, so hi, my name is Danny Jin. So I will be doing my internship presentation today under Dr. Mustafa. It was an internship in a UNC Chip Learning Implementation Science team. My work was to build a data model for healthcare data standards. So for today, during my internship presentation, I'll be doing a quick introduction of the team and its goals, and then go a little bit of the background information about healthcare data standards, and then walk you guys through the work that I accomplished during the internship and the challenges I faced. So the Learning Implementation Science team is composed of multidisciplinary team members with multiple projects being done at the same time. There were, I believe, two computer science majors and me, myself, and Dr. Mustafa. So it was very diverse. I believe one of the team members had a previous career in WHO. So we had some nice feedback on global health and healthcare data standards. So the team had weekly meetings to discuss what we did during the week and take feedbacks and suggestions and decide upon what the next step would be with our work. Our ultimate goal was to build an online resource that demonstrates implementation in healthcare. So this is a nice definition of data standards. It is the principal informatics component necessary for information flow through the National Health Information Infrastructure. Healthcare data standards has been existing for quite some time now, but the importance of them really shined during the COVID-19 pandemic, where we needed a unified understanding of the disease and a big complete picture of it as soon as possible. And these healthcare data standards really helped. It ensures interoperability between multiple sources like care providers, labs, insurance companies, healthcare public agencies, and more. And they ensure that all the systems are on the same page and they work at the same format in storing, sharing, and interpreting information. So healthcare data standards are developed by SDOs, or standard developing organizations. There are more than 40 accredited standard developing organizations, and some of the renowned ones are HL7, NCDPD, which created the HIPAA standard for security. The IHTSDO organization created the SNOMED CT, which is a standard for clinical terminologies, and CDISC, which developed the SDTM standard, which is used for clinical studies by pharmaceutical industries. And these newly developed and updated data standards come out and released every year. And there's a lot of data standards out there. You can see the famous International Classification of Disease standard has 6 versions of it. The SNOMED CT standard has newer versions released every year. So we believe that building a database of healthcare data standards containing essential information for implementation could really help future users of these healthcare data standards to choose and implement these data standards. And we incorporated 4 dimensions of information, which includes the definition, who developed it, who maintains this standard, and who uses it, and lastly, how to use it. So this is the work progress in a step-by-step overview. So you can see that I am currently in a very early stage of the work of building a data model for healthcare data standards. So I will be going over what the steps that I took for this internship. So after doing some research, we had to decide upon which database engine we would use to build and create the database. So I chose the DB browser for SQLite, mainly because I had experience with it, and mostly it's free. It was open source. It's easy to use. It doesn't need any setup of servers. So I chose this engine because it's fairly simple. So it was perfect for the initial stages of my project. So after deciding the database engine, I started building a relational database. So this is initial stage of the entity relationship diagram with the entities. These entities were decided based upon the dimensions of information. So you can see the healthcare data standard and the user entities, or the healthcare data standard and the purpose entities covers the definition and the who develops it, who maintains it portion of the dimension of information, and the user entity and the example entity covers the other dimensions of information. So while we developed these ERD diagram, we used a method, a user-centered method, and developed user profiles. So we decided upon 4 areas of profession that are used or research healthcare data standards. So the areas I came up with was research, hospital, government, and EHR vendors. And I developed the user profiles like the clinical researchers, university researchers, EHR implementation coordinators, public health agencies, policymakers, and system developers. They're all stakeholders of healthcare data standards, and they in their work they would come upon healthcare data standards, whether they would implement them or choose them for their respective areas of profession. So I'm gonna just give you an example of the questionnaires that I developed or came up with in the perspective of an EHR implementation coordinator. These are the questions that I came up with, and I'm just gonna go over one of the questions and give you guys what the logic behind it was. So for this question, which data standard do other hospital organizations utilize for billing? I would have to answer. My database would have to be able to answer this question. So in this database, I would be under healthcare data standards. I would be able to answer the name of the healthcare data standard, and under user entity, I would be able to answer the name of the organization, and then under purpose, I would be able to answer if it was for billing purposes. So with this logic, I created the attributes, and this is the final version of it. So the future work that I would have to do, or the next step would be to develop the data schema and data dictionary, which is to ensure the quality and the integrity of the database. And then I'll go on to build the database on the database engine that I chose. So during the internship, there were some challenges. So this was a project, very individualized project. I had to work on it on the ERD diagram alone, but there were times that I wanted some different approaches and different thoughts on deciding upon the entities and the attributes. And we had weekly meetings where it was an hourly meeting where we had to discuss the individual projects of our team members in an hour. And it was difficult to fully talk and discuss about the project. And the main difficulty was the project had a vague finish line, and this it was not decided. We believe that the database for healthcare data standards is is going to be used for future projects in the healthcare informatics research area, but there was no specific scope or indications of success of my project, which really made it difficult in deciding the achievement progress of my project. So that concludes my presentation, and I'll take questions.